Welcome to Pioneer Advanced Hair Transplant Center. Today, I would like to discuss a lucky patient or a miracle patient, a class 6 baldness, having class 6 baldness, and achieved fantastic coverage and density and blending in one session. Kindly watch the video until and to understand why that happens in only a few patients, why it's not going to happen in all the patients. Okay, there are a few factors we need to talk about this kind of cases to achieve a maximum density or coverage, whatever it is. Well, this patient aged 38 years and having a class 6 baldness, a male pattern baldness, provided a thick donor density. Donor density, usually the criteria of checking for donor density is we check the density per given square centimeter, area of the available donor area, the backside, and then how many hairs are there in a single follicular unit, multiple, triples, quadruples, okay, like that. And also texture of the hair, if the shaft is thick or thin, is a wavy hair or thick hair or slender hair, all this really matters. This patient has kind of a favorable donor, the best donor density, and number of the hair for each follicular unit were more than 3 on average. And second important factor was the scalp dimensions is very small. In the sense, though he is suffering with class 6 baldness, the area of the baldness area is less when compared to average size of the scalp. This scalp was approximately somewhere around 230 square centimeters. Usually some people have even 350, 400 square centimeters. So that's the main reason, having the donor, best donor, and having the scalp size smaller would always give you more density in one session. So provided all these factors positive and in favor of surgery, we almost harvested 4,430 grafts in single day procedure. Kindly remember, this kind of number would not be possible in all the patients. Provided he had good density, good skin, harvestation was so easy, and there was no bleeding and small scalp. All these were the favorable factors for getting the fantastic results for this case. Well, as I already told you, this kind of miracle results, a miracle number of the grafts may not be possible in all the patients. I would get to see this kind of patients once in, I think, 4 to 5 months. So that's the rare kind of combination that happens. And that's the reason most of the patients have a different kind of results and outcome. So, well, having said that, if this patient had a bigger or larger scalp, provided more than 350 square centimeters, provided same number of the grafts, would always need second session. So here we also took care of a kind of planning a little higher hairline because age is 38 above, and we implanted kind of a natural angulations and orientations and blended to the crown area so smooth, such a way that he had left with very few, 5% of the density less in the back, would always give you a transition zone of looking very natural transplantation. Here, most of the people have not only getting hair on the scalp, it has to look natural basically. That's what happened in this patient. Good density, nice hairline, where is a very natural hairline, the kind of blending to existing style made him beautiful look and younger look. Well, if you want to go second session, of course we can definitely implant more grafts in crown area or frontal area also. That's the reason we did not implant during first session in the frontal area to make him more younger look, because probably if you don't get more density in the crown area, obviously second session becomes mandatory for him. Now we made it optional for him. So these are the few things surgeon will take care of while designing your hair transplantation and execution. Overall, this kind of patients we will get to see once in 4 to 5 months, and happy to see such kind of patients. But well, kindly remember, having class 6 baldness for most of the people would always need a second session. So this is a kind of a exclusive special case where everything went in favor. That's the reason he achieved a best density in single session. Otherwise, extracting more than 4,000 grafts may not be possible in a single day. Thank you.